Thank you for joining me today for the Recall Types and Custom Recalls webinar. In this webinar, we will cover default recall types and how to find them, editing recall types, the 3 special recall types, how to manage recall types for individual patients, how to use the advanced scheduling functionality of the Make Recall button, and how to create custom recall types and schedule a custom recall type. How to find recall types in OpenDental. We will start by going to Setup at the top left toolbar, Appointments, and Recall Types. The default types that are available when OpenDental is first installed are Prophy, Child Prophy, and Perio. You'll notice that these are special types. The Exam, 4 Bite Wings, FMX, and Pano. You'll note that there is no time pattern for imaging recall types because if the patient is due for these procedures, they will automatically be added to the patient's special recall type and would use the time pattern of that special recall type. How to understand the recall types window and be able to edit as needed. The triggers are used to determine which procedures associated to a certain recall type, when set complete, make the patient due for their next recall appointment. The interval determines when the patient becomes due for their next appointment. This window controls the default for all patients. However, the interval can be changed on an individual patient basis. We will get to that a little later in this webinar. The time pattern determines the default length of the recall appointment when you use either the Make Recall or Family Recall buttons over on the far right of the program. Procedures indicate which procedures will be added to the next appointment created using one of these Make Recall or Family Recall buttons. We're going to go into the Prophy recall type by double-clicking so that you can see the Edit Recall Type window. The description of the recall type is at the top, the special type associated to this recall. Append to Special checkbox would only be used if this recall type is a custom recall type and you also want to have that particular recall type attached to the next special type appointment for the patient. The procedures that trigger this recall type being needed for the patient is when a prophylaxis adult or prophylaxis child is set complete. That tells the program that the default interval, in my example of 6 months and 1 day, the patient would then be due for their next prophy appointment. OpenDental will automatically create the patient's next appointment using the default time pattern you see here. In my example, my system is set up for 10-minute increments on the schedule. That makes this time pattern of 6 digits, the dashes indicating assistant time for intake and outtake of the patient, and X's for provider time. I have 6 indicating that the automatic appointment will be created for a 60-minute time slot. The procedures on that next appointment will automatically attach a prophylaxis adult. You may be wondering, seeing the prophylaxis child as a trigger procedure when set complete, that it would automatically create an adult prophy. That's not the case. We're going to go into the child prophy now to show you an age criteria that must be met for the patient to have child procedures on their next appointment. We're going to double click into the child prophy, and you'll notice this also has a special type, but the child prophy has a little different than the procedures that we're triggering on the prophy. OpenDental will use the age limitation of a patient 12 years or younger to indicate their next automatic appointment will not be a prophylaxis adult, but a 30-minute appointment with the prophylaxis child and the topical application of fluoride. If you want to change procedures on that next appointment or remove them, the Add and Remove buttons here. patients won't have a recall type of child prophy because Open Dental is only looking at that age criteria to determine if the appointment needs child procedures. So what are special recall types and why are they special? The prophy, child prophy, and perio, these three are all needed in the Open Dental program for it to work as intended. Even if you do not use a special type, it is not recommended that you remove the special types. We'll go into the 4 bite wings to demonstrate how these special types are used. The 4 bite wings is not a special type. However, the box is checked for the append to special. This means that if a patient is due for 4 bite wings, they will automatically be added to that next appointment where they are needed. In this case, the default interval is 1 year, and once again, that time pattern is blank because it uses the time pattern of the special type. Now that you understand what triggers a recall, let's go over how to edit and schedule a recall. We're going to go into the family module of a patient who is currently due for his recall appointment. If you'd like to edit patient information, such as the patient's preferred method of contact when they're due for a recall or their preferred hygienist, you can double-click into the patient information section. The preferred recall method will show up in the lower left-hand corner, and you can use the drop-down to add or change the patient's preferred recall method. This will help you in the recalls list. In our case, our patient does want to be reminded that they're due for their recall via email, so we're going to leave that preference alone. Our patient also has a preferred hygienist, so under the secondary provider section, we can use the drop-down to add or change our patient's preferred hygienist. We will click OK, and that will update the information in our patient's information section. Now we will go into our individual recalls for this patient in the recall section in the top right corner. To do this, we will double-click into the recall. If this patient needed to be a prophy patient instead, the Set Prophy button is down in the bottom center. For this patient, we're going to set them back to being a perio patient, but we do need to make an edit on this patient as their recall interval should be 3 months instead of 4. I'm going to double-click into the perio line to open up this edit recall for this specific patient. We're going to change the recall interval to 3 months instead of 4. This window is also helpful if you have information from the patient's prior provider of when their bite wings, perio, prophy exams were last done to be able to update this with accurate due date information. You can also use this window to update an individual patient's contact status for their recall. This can be done more efficiently using the recall lists in the appointment module. That is in a different webinar. You can set this patient as needing to be scheduled ASAP, typically helpful for those patients that are past due for their appointments and you weren't able to get them scheduled as soon as they'd like. You can check the box for Schedule ASAP to have them show up on an ASAP recall list in the appointment module. Administrative notes can be added, but this note will get deleted every time the recall gets reset. This can be helpful for patients who may be going back and forth between a prophy and a perio appointment. Administrative notes can be added, such as, after scheduling, check with doctor about moving him to prophy for next appointment. Obviously, that is not a note that you would want to stick around for each recall. So keep in mind, this note will be here during this recall needing to be scheduled, but not future. You can also use this box to disable recalls. Always disable if you prefer to disable them showing up on your recall list without having to inactivate your patient. Until the family account balance is below a certain dollar amount, if you're having a patient who's having difficulty paying and you don't want to schedule their recall appointments until they've been able to pay down their balance. The until date can be helpful if your patient is going overseas or is a student who's gone off to school. This will make it so that you can disable their recall until they're actually able to schedule their recall cleaning appointment. We'll click OK, and you'll notice it has now updated the due date on my patient, the intervals, and I do have that note to pay attention to. I'm going to close this window, and we're going to schedule our patient's cleaning appointment. From the appointment module, over on the right-hand side of the screen, we have the Make Recall buttons and the Family Recall button. I'm going to click on the Make Recall button. You'll notice that since my patient was past due for their appointment, it's going to show me today's date onward for available time slots. If your patient is due in a future time and you have your schedule set up inside of Open Dental, the calendar will jump forward for you to that patient's due date for their recall. In this case, my patient is available to come in on 4/22, and I can either choose that from my calendar or from my openings in the appointment view. If you'd like to look for a different provider or be able to see the schedule for all hygienists, down at the bottom of the openings view is a provider button. Clicking on the provider button will allow you to highlight a different provider to look at their schedule, or click on a hygienist button to be able to see the schedules of all available hygienists. You'll notice it added in both providers instead of one, and it gave me an additional hour time slot to look for my patient. My patient would prefer to come in on April 22nd, so I'm going to click that time slot, and it did move my calendar forward for me. At this point, I can click the appointment from the pinboard and drag it to an available time slot. You'll notice on this appointment that since my patient was due for their bite wings, that it automatically attached those bite wings to their periodontal appointment. We'll click OK and go over a couple of other ways you could schedule the recall. Make Recall button will be the easiest and most efficient way to schedule the recall. You also have the option of the View Patient Appointments button to be able to see when any appointments have been scheduled for the patient. You can schedule a recall appointment using the Create New Appointment button. However, keep in mind that when you schedule a cleaning without using the Make Recall, it doesn't pull the default length of time for you. You'll notice that my 1 hour appointment does not come through. It starts at a 30-minute appointment. It doesn't add the procedures for you, and it won't check for any additional procedures that are due, such as the imaging. You can still schedule the recall this way, and it will remove the patient's name from the recall list, but it's just more work. The other option for scheduling a recall is the Schedule Recall button from inside this window. Clicking on the Schedule a Recall button, if the patient has already had their recall scheduled, will pop up a notification stating that the recall has already been scheduled and the date. This is helpful to make sure you're not creating duplicate appointments. Now that we've scheduled our patient for his appointment, the family module has now been updated to show that our patient is due, but they're also scheduled. Now we'll go into a patient who's part of a family. This patient and her child are both due for their recall appointments. You will notice once again that even though my patient is a child, they do not have a child prophy type. That's because my patient is below that 12-year mark, so they're still going to be scheduled for prophy, but Open Dental will choose the child procedures instead. we're going to go into our child patient and indicate that he has a preferred hygienist he likes to see. We're going to double click and use the drop-down to select our provider. Now we're going to go to the appointment module, and regardless of which family member you have selected, if you choose the Family Recall button over on the right-hand side of the screen, it will create an appointment for each patient that's due for their recall. It will also move that schedule forward to the available dates and times of when your patient is due. You still have the option to choose the providers if you would like to change it. You'll notice in our pin board that I have both our child appointment, which I can click and drag onto the screen. I can also click and drag the mom's appointment separately. We're going to change the provider in this case, and we're going to keep the length the way that we've told Open Dental to create that appointment for. So we're going to say no to changing the length for the provider. You will notice that it created an appointment for each individual patient with the correct procedures that were needed on their appointments. My child has the periodic oral evaluation, our prophylaxis for the child, and that topical application of fluoride. Now that we've created appointments for our patient, let's go over how to create a custom recall type and have it show in the recall list. I'm going to create an example for endo follow-up. This means I also need to create a no-bill code for that follow-up to be attached to a future appointment. To do this, we'll start by going to Lists, Procedure Codes, and New. We're going to put in our procedure code name of endo follow-up. Mark this as do not usually bill to the insurance, and create it in the category of no fee, and add it into the system. If you have already created a code, or you're creating a code that already exists in your system and you need to change the procedure code instead, Open Dental will notify you that the code already exists. Now that we have our code in the system, we can see that under the no fee category. Let's go ahead and create the custom recall type using this feature. To do this, we'll go to Setup again, Appointments, and Recall Types. To create a custom recall type in Open Dental, we're going to use the Add button in the lower left-hand corner. In this case, I've already done the work of setting up our endo follow-up, so let's go over how it's been set up. And it looks like we need to make a few edits to it. We're going to double-click into the endo follow-up. The description is what I want it to be. This is not a special type, as special types are prophy, child prophy, and perio. And you need to make the decision at your office if you want this to append to the special or not. You can choose to append this to special only if you are okay with it automatically being added to a recall that is due for the patient. We'll append a special for now to show you what I mean. The procedures that trigger this recall type need to be added into the system. We'll click on the Add button, and in this case, I'm going to attach more than one procedure because I want to make sure that if any of our endo codes get set complete, that it will still trigger a follow-up. So I'm going to choose 3 procedure codes and attach those, so if any of those procedures are set complete, it will indicate that our patient needs to be followed up with. Doctor wants me to indicate that this follow-up should be done in 6 months, so we'll set that as a default recall method. When automatically creating the next appointment, doctor wants a 20-minute follow-up appointment with himself, and the procedures that are going to be automatically created on that appointment is that new no-fee code we just created. We're going to click the Add Appointment and attach it. Now we can click OK, and now our trigger procedures are on that follow-up, our interval, and our time pattern. We'll go ahead and close, and I'll show you how to use the custom recall types once you've created them. Let's go into another patient. This patient currently does not have the endo follow-up. In order to get a custom recall type to be triggered, we need to set one of those trigger procedures complete. So I'm going to create an appointment for our patient. We're going to add on any one of those 3 procedure codes to the appointment. And you do need to set that appointment complete. This is going to trigger that our patient is now due for that endo follow-up in 6 months. If you would like to add recall types to the recall list for things such as follow-up so that you can follow up with them on the recall list, you would start by going to Setup, Appointments, and Recall. The lower left-hand corner shows the types of recalls that will show on the recall list. To add the endo follow-up to that recall list, you will want to hold down Control on your keyboard and select endo follow-up. If you accidentally forget to hold down the Control key, keep in mind that it will only select the item you click on. Holding down Control allows you to skip through other recall types and only highlight the ones that you want to see on the list. We'll click OK and go to the Appointments and the recall list, which is just above our calendar in the far right-hand corner. Your recall list will now have the ability to show patients that are due for that recall follow-up. You can also sort through your recall types by clicking on the recall type drop-down and choosing that you just want to see your endo follow-ups and refresh your list. For additional resources on the recall list, please see our recall list usage webinar. Thank you for joining me today. If you have any questions about this process, please feel free to contact our support team